And we're live. Good morning, Facebook. This is Heath Waldrop. I'm the marketing director at South Arkansas Community College. And I've changed locations again. Every day we're bringing you a different location around our campuses. And if you look around here, you can see that we're in something that looks somewhat like an operating room. Well, there's a reason for that. I'm here with Brandy Mendoza, who is the Surgical Technology Program Director at South Arkansas Community Colleges. It's one of the many health science programs that we have here at SouthArk. And Brandy, if you could, introduce yourself and tell us a little about your background and what you do here at SouthArk.
Well, good morning, Heath. How are you? And Facebook world. Like you said, my name is Brandy Mendoza. I am the Program Director. I have been with SouthArk for 9 years now. I actually started in 2011. I graduated from this program and worked at the hospital for 5 to 6 years as the clinical instructor, as the clinical coordinator in the skills lab and some classroom work. 2016, I applied for and was accepted as the program director. And so since then, this is where I've been and loving every minute of it.
Now, we're both wearing surgical masks today. This is in the middle of the pandemic, obviously something a lot of us have been doing, but not something that you're unaccustomed to or that your students would be unaccustomed to doing, right?
Right, not at all. This is exactly what we are. This is what we do. This is our life, to be in PPE and sterile attire. This is what we trained for right out of the gate from the first day, is how to don, which means to apply and wear correctly, masks and gowns, surgical hair covers, shoe covers, and any other PPE that would protect us from the operating room.
So what does a surgical technologist actually do? What are you training to do other than donning a PPE? What else are you training surgical technologists to do?
So we actually are an integral member of the operating room team. We help with everything from the patient coming in with vital signs, catheterization. We transport our patient to the operating room. We are able to position our patient to accommodate the surgical procedure. We learn all of these instruments that you see all around us. We learn these. We learn surgical procedures. We learn how to, most importantly, prevent infection in our patient.
I happened to be here for a lab activity earlier this year where you guys were talking about sterilization, and the minutia that goes into that. I think a lot of people would not realize, because as soon as something touches something else that's not sterile, then it becomes not sterile, and so that there's a whole lot to think about.
That is correct, and probably one of the hardest concepts as well for students to learn before they can go to clinical is what is sterile, what's not. What can I touch? When can I touch it? How can I touch it? And then afterwards, how do we make it clean again? Like you said, the sterilization portion. There's so many different ways to sterilize instrumentation. Something that a surgical technologist can also do is work in sterile processing and learn how to clean and sterilize instrumentation and supplies.
Well, since we have the benefit of having a really wide angle here and being able to see the lab, which, by the way, the lab's amazing here. If you've never seen it,
the best.
I mean, it looks like a hospital operating room. It has all the same equipment that you would see. Why don't you talk about maybe some of the stuff that's out here, because some of this stuff's kind of intimidating looking. Or maybe you can hold up some of it and talk about it.
It does. It can be very graphic, almost gothic looking at times. But some things that we do start off with are our general surgery instruments that allow us to handle just for general or basic cases. So what I have here are 5 different types of scissors, and you can see they're different sizes, but they're all used for different things. And so we have to learn what they're used for, which is the function of them, but importantly, the name of them, the hospital name for them, what the surgeon calls them, and actually when to anticipate the use of that instrument. We have what everyone calls tweezers, but they're not actually tweezers. They have a little tooth at the end of them, and that tooth allows us to grasp tissue and to hold on to it. The surgeon never actually handles the tissue with his hands. He uses instruments to grasp the tissue and to hold on to it.
And they come in very handy at the Chinese restaurant. For those of you who have not mastered chopsticks yet.
Very good.
That's an off-label use.
They do come in different sizes for different uses. Like the longer ones would be for deeper down inside of the body cavity. The shorter ones would be on the surface. And so we learn when to use those. We have, I guess, different types of chopsticks that you can use that allow us to open our patient to be able to visualize the anatomy inside of our patient. Another example would be this Balfour retractor, which usually steers people away from our tables, but this allows us to be placed inside the patient, and we can open it up and it retracts the walls of the abdomen so we can see the structures inside, and it allows us to be able to work on those tissues. Here we have very commonly what we call a Bovie pencil, but it's an electrosurgical pencil. So we get to learn all of the safety about using electrosurgery in the operating room. Staplers, not paper staplers, body staplers. So we use this very commonly to staple our colon. And so this has replaced...
Or your semicolon if you're literary.
That we are able to staple it cuts it, it staples it closes it, and it really reduces time in the operating room from having to use so many sutures. When I say sutures, hundreds and hundreds of different types of sutures, which everyone really knows as stitches.
Right.
So there's so many different kinds for so many different areas of the body, we get to learn that.
That was always like a rite of passage as a child, like, over the weekend I cut my leg and I had to have 7 stitches, and so then a few weeks later somebody else I had to have 20 stitches, and so who on the playground had the most stitches?
Everyone wants to know, how many stitches did you get? How many stitches? So we do use stitches inside, we use stitches outside, we use staplers inside. We use staplers on the outside. Some people have staples to close their skin, which is much faster. It has less risk of getting infected and very easy to remove. Very less likely to come undone. We also learn about medications, which I don't think I have any on the field this morning, but there's a ton of different medications that we use in surgery, so we learn how to handle them safely and accurately so that we don't harm any patients.
So you guys have lots and lots of toys that you
Yes.
that you use in your program. Tell us about if somebody was interested, and hopefully somebody out there is interested in this program. If they were interested in this program, what sort of coursework do you have to take, and then what do we offer in terms of completion, graduation, and in terms of a degree or a certificate?
Okay. In this program, it does require 1 year of prerequisites that lays the groundwork or the foundation for us to be able to enter into the program. We have A&P1 and A&P2, which is anatomy and physiology. We have microbiology. We have medical terminology, which are really the most important of any healthcare career. We have math for health professionals. Since we handle medications on our field, we have to be able to calculate everything used. We do Comp 1, Comp 2, so we're able to document accurately and correctly patient information. And then we also have general psychology, because we have such a diverse patient population that we are exposed to in the operating room. Once you have taken the prerequisites, you apply for the program. This is a 1-year program. It's 40 credit hours, and you will graduate with an associate degree upon completion. So it's an associate of applied science, and this program allows you to sit for the certification exam. which goes all over the country. You don't have to renew from state to state to state. And it is good for 2 years right now. So every 2 years you'll renew and be able to work in hospitals, doctor's offices, surgery centers. There's a lot of different places that you can take the degree. You can go to where they actually make and sell the goodies that we get to play with. So you can be a sales rep and go to the different hospitals and teach people how to use the new things. What else do we do? Some people go and work at vet's office to be a veterinarian assistant with the skills that we have, and then you can also teach.
Well, so I'm sure that you've maintained some contact. You've been here for a while. You've maintained contact with some of your grads. Where are some of them working now, as far as the around the country? Where are some of the places that they've gone to work?
In particular, a hot spot that our students go to is Texas. They absolutely have so many opportunities in Texas for so many different things. Several of them are there. We have students as far as Oklahoma. We have a lot of them that have just gone to Central Arkansas. They're in Conway at Baptist, and there's an eye center up there that we have one. We have so many that are local that are at Medical Center of South Arkansas. Trying to think if we have any more. We have some at Monticello, several at Camden that are able to work there. We have the surgery center, the South Arkansas Surgery Center. We have a graduate over there. And like you said, I do maintain contact with them consistently. And even those that possibly were not successful in the program or with the certification exam, I work with them very closely to get them working and where they need to be able to work.
Okay, great. Well, so any questions that might be filtering through at the moment from anybody out there watching us live? And of course, this video will be posted, and so if anybody happens to have questions later on watching it after we're not live anymore, you can always ask those at that time. And then if you're interested in getting into this program, you can always go to southark.edu/info, and then someone in our recruitment department, and you can make contact that way, and then we'll answer questions for you, possibly set up a tour, allow you to meet Brandy, and so she can tell you more about this program. So just generally, and I've heard you give the pitch many times at this point, but for the people out there who haven't, why should someone consider, what type of person should consider this career path, and why should they consider it?
So I would say I chose this career, I chose this path because it is a way for people to help in healthcare and to be able to participate in healthcare without a lot of patient interaction. We do transport and transfer, but we're really helping, and we are behind the scenes. We're big people that so many do not even know we exist, that because we're behind the mask, which the whole country understands now. But like I said earlier, it's because that's why I chose it, because I can participate without any glory. There's no paperwork really other than documentation that we have to do, very small documentation that we have to do that would require us to continuously document things. So we don't have to do that. We can travel the whole entire country with our certification, and so we get to see different places. There are traveling positions available that they really pay a lot of good money. So a lot of people choose that, and they're able to go anywhere in the United States with the certification. Also, anyone who just really enjoys all the hands-on skills. We do so much hands-on. It's not for the weak of the stomach. We do surgery in many different specialty areas, whether we're in labor and delivery. So many students or graduates are hired in labor and delivery, so we get to do that. Heart surgery, I've held a heart in my hand before. We get to participate where all the action is. And so if you're really someone who's interested in the action and participating in that, this is a really good field. We work in trauma surgery, so you can be right in the middle of the action, saving lives.
All right, so if any of that sounds appealing to you, surgical technology might be the route to go, and we would love to talk to you more about that. Again, southark.edu/info, info, and you fill out the contact card there, and then someone in our recruitment office will get back with you, and we'll start that conversation. Again, thank you, Brandy, for your time and for allowing us to descend upon your lab and move things around a little bit.
I love people here.
So, she really does too, because we always make sure when we give tours of this building, we always make sure that even if somebody's interested in a different field, we allow them to come by here just because the bells and whistles are so cool. So, and again, appreciate anybody out there watching right now, and would love to talk with you more about this program or any other program at SouthArk. Have a wonderful day.